Let's talk about the ascending tracts. So on entering the spinal cord, the sensory nerve fibers of the spinal cord of different sizes and functions, they're going to be sorted out and they're going to be segregated into nerve bundles or tracts in the white matter, that is the outer matter. Some of the nerve fibers are going to serve to link different segments of the spinal cord, while others are going to link the spinal cord to higher centers of the brain. These bundles of ascending fibers, they're referred to as the ascending tracts. The ascending tracts are going to conduct two types of different informations, like the afferent information, which may or may not reach the consciousness level. So first of all, we're going to have exteroceptive information, which originates from the outside, like the pain, temperature, and touch. And then we have the proprioceptive information that originates from the inside, for example, from the muscles and from the joints. Now let's talk about the anatomical organization of the ascending tracts. So general information from the peripheral sensory nerve endings, they are going to be conducted through the nervous system by a series of neurons. So neurons are going to conduct all kinds of information. In its simplest form, the ascending pathway of consciousness is going to consist of 3 neurons. So we are going to have first order neurons, and then we are going to have second order neurons, and then third order neurons. So there's a very easy way to remember this, that is by PAT. So the first order neurons are mostly going to carry the posterior root ganglion, and the second order neurons are going to contain the axons, like the substantia gelatinosa and the nuclei of the gracilis and the cuneatus. And the third order neuron is going to consist of the thalamus. Now let's talk about the functions of the ascending tracts. So first of all, I want you to remember LST, LPT, like lateral spinothalamic tract is going to conduct information like pain and temperature. If we talk about the anterior spinothalamic tract, then it is going to carry the crude touch, like AST and ACT, LST and LPT. Lateral spinothalamic tract and lateral, this is just for remembering. And then we have P and T, pain and temperature. And then for the anterior spinothalamic tract, I have AST and ACT. If we talk about the sensations which are going to be conducted by the white columns, then they are going to include the crude touch and the muscles and joints movement, as well as position of different parts of the body, as well as vibration. And what about the unconscious information? The unconscious information from muscles, joints, and the skin and the subcutaneous tissue is going to reach the cerebellum. Okay, whenever you remember unconscious information, what are we going to remember? We are going to remember the cerebellum. And also by the cerebellum and the cuneo-cerebellar tract through the anterior and posterior spinocerebellar tract. So by the SCT and also by the CCT. Pain, temperature, and tactile information are going to pass to the superior colliculus, and then they are going to reach the spinotectal tract, and then they are going to cause the reflexes like spinovisual reflexes. So for the pain, for the temperature, and the touch, the information is going to go towards the superior colliculus and then towards the spinotectal tract. How to remember spinotectal tract? Because tect as in touch, like tactile sense, and then into the spinovisual reflexes. Now this is something that is extremely important, which is main somatosensory pathways to consciousness. So first of all, I'm gonna tell you about these sensations. First of all, we're going to have general sensations, okay, like pain and temperature. And then we are going to have pressure sensations like light touch and pressure. And then we are going to have specialized sensations like discriminative touch and vibration and conscious muscle joint sense. Now let's talk about the receptors that will conduct these sensations. So for the pain and temperature, free nerve endings are going to be receptors, and for the light touch and pressure, also free nerve endings are going to be the receptors. But the receptors are going to be so much different for the discriminative touch and for the vibration sense and conscious muscle joint sense. This is very important. You can just remember it by PM Tom, like Prime Minister Tom. Okay, so P for the Pacinian corpuscles, M for the Meissner corpuscles, and TO for the tendon organs, and M for the muscle spindles. Now let's talk about the first order neurons. For the first order neurons, I advise you to remember these 3 things. P for the posterior root ganglion, right? So just like posterior root ganglion, posterior root ganglion, posterior root ganglion for all 3 sensations. Now let's talk about the second order neurons. So for that, I wanted you to remember the axons. Substantia gelatinosa are going to be responsible for the sensations of pain and temperature, as well for the sensations of light, touch, and pressure, like for the pressure sensations. But for the specialized sensations, we are going to have the GC, that is nuclei gracilis and nuclei cuneatus. Now let's talk about the third order neurons. For the third order neurons, I asked you to remember the thalamus. So we are going to have the ventral posterolateral nucleus of the thalamus, or VPL of the thalamus, for all 3 sensations. Now let's talk about the pathways. So for the pain and temperature, I asked you to remember LST, okay? That is the lateral spinothalamic tract. Now you also have to remember the SL, with spinal lemniscus. For the light, touch, and pressure, I asked you to remember AST, that was the anterior spinothalamic tract. For the ACT, right, for the crude through touch and pressure. So for this, we are gonna remember the spinal lemniscus. That was the SL. Now let's talk about the specialized sensations and their pathways. So for the specialized sensation pathways, this is very easy. You are just going to remember some fasciculi. You only need to remember the fasciculi gracilis and the fasciculi cuneatus. That is for GC. And also you can also remember medial lemniscus for the discriminated touch. Now let's talk about the destination. So destination is always going to be PCG, which is the posterior central gyrus. Now let's talk about the pain and temperature pathways. Pain and temperature pathways in the skin and the other areas are going to have the receptors of free nerve endings, and the pain impulses are going to be transmitted towards the spinal cord in the fast conducting fibers through the A delta type fibers and the slow conducting C type fibers. So the fibers are going to be slow conducting as well as fast conducting. Fast conducting fibers are going to be A delta fibers and the slow conducting fibers are going to be C type fibers. The fast conducting fibers are going to alert the individuals to initial sharp pain, and the slow conducting fibers are going to be responsible for prolonged burning and aching pain. The sensations of heat and cold are also going to travel through the A delta and the C type fibers. Now let's talk about something that is extremely important, which is the lateral spinothalamic tract. So from the lateral spinothalamic tract, do you remember what I told you before? What is going to pass? Like what kind of sensations? So I want you to remember pain and temperature at first. All right. So I just want you to remember the receptors, which are going to be the free nerve endings. And then I also want you to remember the first order neurons, which are going to be the posterior root ganglion. When the posterior root ganglions are going to reach the posterior gray columns at the root, they are going to divide into ascending and descending fibers. And then they're going to form the posterolateral tract of the lissor. And now let's talk about the termination. So these fibers are going to terminate by synapsing with the posterior gray columns. And they're also going to include the substantia gelatinosa. What neurotransmitter is involved in the synapse? So we have the substance P. Then there's going to be the process of crossing over. So axons are going to cross over to the opposite side or the contralateral side over the posterior gray column, and also the white commissures within the first spinal segment. And then they're going to ascend in the opposite or contralateral white columns as the lateral spinothalamic tract. And lateral to the lateral spinothalamic tract, we are also going to see the anterior spinothalamic tract, which is responsible for unconsciousness. So in the upper cervical segments of the spinal cord, the sacral fibers are going to lie laterally and the cervical segments are going to lie medially. You can remember this with S, L, and C, M. The fibers carrying pain are situated slightly anterior to those which are carrying temperature, as you can see here. The pain fibers are going to be higher as compared to the temperature fibers. As the lateral spinothalamic tract is going to ascend towards the medulla oblongata, so here we can see that after forming the spinal lemniscus, which is basically a combination of the lateral spinothalamic tract, anterior spinothalamic tract, and the spinorectal tract, it is going to enter the pons and the midbrain. So, but after ascending in the opposite contralateral part, we are present here in the medulla oblongata. So if we talk about the medulla oblongata, it lies near the lateral surface and between the olives and the fifth nerve, which is the inferior olivary nucleus, and also the trigeminal nerve spinal tract. But they are now accompanied by the anterior spinothalamic tract and the spinotectal tract, like they are going to form the spinal lemniscus. The spinal lemniscus is going to continue towards the posterior part of the pons, and then it is going to enter the midbrain, specifically the tegmentum, which is lateral to the medial lemniscus. And then they are going to terminate as the ventral posterolateral part of the thalamus. What happens after entering the thalamus? So basically the thalamus was a third order neuron. Now they're going to pass towards the posterior limb of the internal capsule, and they're going to pass through the internal capsule as well as the corona radiata, and then they're going to enter the PCG. Okay, the posterior central gyrus. Contralateral half of the body is represented as inverted, like with the hand and mouth, which are going to be situated inferiorly, and the leg is going to be situated superiorly. And the foot and the anogenital region is going to be on the medial surface of the hemisphere. From here, the information is going to be transmitted to the cerebral cortex, and it is going to be used by the motor areas and the parietal association area. The role of the cerebral cortex is to interpret the quality of the sensory information, which is at the level of the consciousness. Now talk about the pain perception. So the perception of pain is a very complex phenomena that is influenced by emotional state and past experiences. So pain can be divided into two main types of pain: fast pain and slow pain. There is a different chart of them. Fast pain is sensed in 0.1 seconds, which is very fast, and it is mostly sensed on the skin. And it may be sharp or acute, or it might feel like a prick. However, if we talk about the slow pain, it is felt in 1 second, which is a very long time, and it is mostly felt in the tissues because of destruction. So they may feel like burning pain, aching pain, or throbbing pain. Now let's talk about all types of pain reception. All types of pain receptions are going to be conducted through the free sensory nerve endings, and fast pain is experienced by either mechanical or thermal types of stimuli, like mechanical or temperature. However, if you talk about the slow pain, then they are elicited by the mechanical, thermal, or chemical stimuli. Then there are many chemical substances which have been found in the extracts from damaged tissues that will excite these free nerve endings. They are going to include the serotonin, the histamine, the lactic acid, and the potassium ions, as well as the bradykinins. The threshold for pain endings can be lowered by prostaglandins, which is mostly used for relieving pain during labor, and also by the substance P, which can, as they cannot stimulate the nerve ending. Now let's talk about the pain conduction in the CNS. So fast pain is going to travel to the A delta axons at velocities which are between 6 and 30 milliseconds. However, slow pain is going to travel at speed which is between 0.5 and 2 milliseconds. Now let's talk about the pain conduction in the CNS. So afferent pain fibers are going to enter the spinal cord. For example, the posterior root ganglion, and they are going to terminate first of all in the posterior gray horn, and the main excitatory neurotransmitters which are involved in this are released by the A delta type of fibers and the C fibers. And the main neurotransmitter is going to be glutamate. Then the substance P is released from the C fibers as well in case of slow fibers. Whereas the glutamate is a fast-acting localized neurotransmitter, substance P has a slow release. So one more difference is that the slow conducting fibers is going to be not localized. Like, we will not be able to differentiate the area in which we are experiencing it. However, the fast acting fibers are going to be very much discrete about where they are going to be felt. The initial sharp pricking pain or the fast acting pain stimulus is going to stimulate the second order neurons of the lateral spinal thalamic tract. And the axons are going to cross towards the opposite side, and they are going to ascend towards the thalamus and relate to the PCG, which is the postcentral gyrus. However, the burning, aching, slow acting pain is going to stimulate the second order neurons, and then into the posterior gray horn it is going to go, and then it is going to ascend to the axons of the fast acting pain fibers. However, the most of the incoming slow fibers are going to be taking part in the additional relays, including several neurons in the posterior horn before ascending in the spinal cord. So the repeated arrival of the toxic stimuli through the C fibers in the posterior gray horn during severe injury is going to result in an increased response of the second order neurons. So this is going to result in the winding up phenomena due to the release of neurotransmitter glutamate from the C fibers. The majority of the slow pain fibers in the lateral spinal thalamic tract are going to terminate in the reticular formation, and then they are going to activate the entire nervous system. In the lower areas of the brain, the individual becomes aware of the nauseous, suffering type of pain. As a result of research using the positron emission tomography scan, the postcentral gyrus and the cingulate gyrus, as well as the insulator gyrus, are the sites which are concerned with the reception and the interpretation of the nociceptor information, which are the pain information. So we have like cingulate and the postcentral gyrus and the insular gyrus. The postcentral gyrus is basically responsible for the interpretation of pain in relation to past experiences, P for the postcentral gyrus and P for past experiences. And the cingulate gyrus is responsible for the interpretation of the emotional aspects of the pain, whereas the insular gyrus is responsible for the interpretation of the pain stimulus from the internal organs of the body. Now let's talk about the different theories which are concerned with the pain control in the CNS. So we also have a lot of liniments or massages that can relieve the pain. So first of all, we're going to have the gating theory. Gating theory says the site where the pain fibers are going to enter the CNS, inhibition could occur by means of the connector neurons, which are basically the myelinated afferent fibers which are carrying the information of non-painful touch and pressure. So after we introduce these, we are going to feel no pain at all. The excess tactile stimulation, which is produced by massage, is going to close the gate for pain. Once the gate is opened again, the information of the painful stimuli ascending the lateral spinal thalamic tract again ascends the lateral spinal thalamic tract again, which is responsible for pain and temperature reception. Although the gate theory may partially explain the phenomena, the analgesia system is probably involved with the liberation of enkephalins and endorphins in the posterior recall. So now let's talk about the analgesia system. So when we stimulate certain areas of the brain stem, it can basically reduce or block the sensations of pain. These areas are going to include the PVD, which is the periventricular area of the diencephalon, and then the PAM, which is the periaqueductal gray matter of the midbrain. And then we also have the
midline portion of the brainstem. So fibers of the reticulospinal tract are going to pass down towards the spinal cord, and they are going to synapse on the cells that are concerned with pain sensation in the posterior column, and the analgesic system will suppress these pain sensations. Recently, two compounds have been isolated, which are enkephalins and endorphins in the CNS. These compounds are and serotonin. They're going to serve as neurotransmitters, and they're going to block pain. Talk about the anterior spinothalamic tract. Very much similar to the lateral spinothalamic tract. So after entering the spinal cord from the posterior gray columns, the posterior root ganglion is going to travel towards the posterior gray columns, and then it is going to divide into ascending and descending branches, and then it is going to form the posterolateral tract of Lisor. And then the substances gelatinosa are going to be involved in this of the posterior gray columns, and the axons of the second order neurons are going to ascend, and they are going to travel towards the opposite side of the anterior gray and the white commissures in the various spinal segments, and not in just one spinal segment like the lateral spinothalamic tract. And then they're gonna ascend in the opposite anterolateral white column. After that, they're going to go medial. They're going to go towards the medial tract where the new fibers are added, and then they're going to travel towards the medulla oblongata, which has spinal lemniscus, and it also is a combination of the spinotectal tract and the lateral spinothalamic tract. Then they're going to travel towards the pons in the midbrain, specifically the tegmentum part, and termination is going to happen in the ventral posterolateral part of the thalamus. Through the internal capsule and the corona radiata, it is going to travel towards the postcentral gyrus. Now let's talk about the pathway which is involved in the discriminative touch and the vibratory and sensory and conscious muscle joint sets. So this is basically going to be like, first of all, we're going to see ascending and descending fibers. So for the ascending fibers are going to be long fibers, and the descending fibers are short fibers. Ascending fibers are going to give rise to posterior gray horn and the internuncial neurons, and the short fibers are going to give rise to the intersegmental reflex. Long fibers are going to ascend towards the posterior white columns and then into the fascicular. And then they're going to travel towards the long fibers are going to ascend towards the posterior white column and then towards the fascicular, which are gracilis and cuneiform. Gracilis is going to give rise to long ascending fibers of the sacral, lumbar, and the lower six thoracic segments of the spinal cord, and cuneiform is going to give rise to upper thoracic and cervical segments of the spinal cord. And then the long and short fibers are going to ascend, and they're going to go ipsilaterally towards the nuclei of the gracilis and the cuneiform. And then the axons of second order neurons are going to go anteromedially. And these second order neurons include the internal artery fibers. They're going to go anteromedially to cross the medial plane, and then sensory decustation is going to happen. They're going to ascend as a single medial lemniscus, and they're going to go towards the midbrain, pons, and medulla. And then they're going to terminate as the ventrolateral part of the thalamus or the inferior cerebellar peduncle. And then they're going to travel towards the cerebellum through the cuneo-cerebellar tract or the posterior external arcuate fibers. Now let's talk about the muscle joint sense pathway towards the cerebellum. So first of all, let's talk about the sensations. So these are the unconscious muscle joint sensations. The receptors are going to be remembered by Tom, which is basically the prime minister. The TO refers to the tendon organs, M refers to the muscle spindles, and then we have the joint receptors as well. Now let's talk about the first order neuron, which is the same. This is the posterior root ganglion. Now let's talk about the second order neuron, which is going to be nucleus something. So this is going to be ND. This is nucleus dorsalis. And now for the third, no, it has no third order neuron. So now let's talk about the pathways. Pathways are going to be associated with the cerebellum. So anterior and posterior spinocerebellar tracts, and the destination is the cerebellar cortex. Now let's talk about the muscle joint pathways towards the cerebellum. So first of all, the axons which are entering the spinal cord from the posterior root ganglion, they're going to enter the posterior gray column, and they're going to terminate by synapsing on the second order neurons, which are at the base of the posterior gray column, or this is also known as the Clark's column. So basically, this is the second order neurons are the nucleus dorsalis, and then the axons are going to ascend, and they're going to enter the posterolateral part of the white column. So please remember the white column, that from the gray column, the axons are entering the white column, which was basically present on the outside of the spinal cord. So the white column that they're going to enter is going to be on the same side. So now they're going to ascend as the posterior spinocerebellar tract, and they're going to enter the medulla, and they're going to join with the inferior cerebellar peduncle, and they're going to enter the cerebellar cortex. Now, as I said, that after entering the white column, they're going to enter the ascending or descending spinocerebellar tract. So mostly,
they're going to cross towards the opposite side and they're going to ascend as the ascending spinocerebellar tract. But in minority cases, they're going to travel to the white columns of the same side. However, we're going to talk about the crossing over towards the opposite side and formation of ascending spinocerebellar tract. Then they're going to enter the midbrain pons and medulla, and they're going to enter the superior cerebellar peduncle.
And then basically the cerebellar cortex. Now let's talk about the cuneo-cerebellar tract. So this is extremely easy. They're going to originate in the nucleus cuneatus, and they're going to enter the cerebellum through the inferior cerebellar peduncle. And of the same side, they are known as the posterior external arcuate fibers, and their function is to convey information of muscle joints and towards the cerebellum. Now let's talk about other extending pathways.
Spinal reticular tract. So first of all, we're going to have the posterior root ganglion, and then so basically this is the first order neuron. Then we're going to enter the second order neurons, which are unknown. They're present in the gray matter. Then we're going to enter the lateral white column, which is going to be mixed with the lateral spinothalamic tract. And most of them are going to be uncrossed. So the spinal reticular tracts are going to be uncrossed because they're going to form the reticular formation. So reticular formation is going to happen in the medulla, pons, and also the midbrain. And it is going to influence the levels of consciousness.
Now let's talk about the spinolibri tract. So first of all, first order neurons are going to travel from the posterior root ganglion, which was the first order neuron, towards the unknown second order neurons of the gray column. And then they're going to cross the midline and ascend as the spinolibri tract in the white matter at the junction of the anterior and lateral columns. So passing from the gray column towards the white matter, they are going to be at the junction of the anterior and lateral columns. So here I am talking about the spinolibri tract. And then they are going to enter the third order neurons. They are going to synapse here. And then they are going to enter the medulla, and they are going to cross the midbrain. Through the inferior olivary tract, they are going to enter the cerebellum. They are going to innervate the cutaneous and proprioceptive organs. Now let's talk about the visual sensory tracts. So the visual sensory tracts are going to come from the posterior roots, and they are going to posterior root ganglion. So it has peripheral processes as well as central processes. Peripheral processes are going to receive impulses from pain and stress receptors, including the viscera, and the cause of visual pain may be ischemia, chemical damage, or spasm of smooth muscle. And the central processes are going to innervate the spinal cord, and they are going to synapse with the second order neurons which are present in the gray matter. So the central processes are going to synapse, like they're going to synapse with the neurons which are present in the gray matter, and then probably in the posterior or lateral gray columns. So synapse is going to happen in the posterior or lateral gray columns. All right. Axons are believed to join the spinothalamic tract and ascend and terminate in the VPL of the thalamus, which is the ventral posterolateral part of the thalamus. The final destination is the PCG, which is the postcentral gyrus. They are also involved in the reflex activity.